Hi, I'm Dr. Joel Cherdack. One of the topics that often gets missed when speaking with stem cell therapy clinics regarding stem cell therapy is who is not a good candidate for a stem cell therapy procedure. So let me start off with a few examples. One, if a patient has or has had active cancer recently, stem cell therapy is not a good option. We do not treat patients with active or recently active cancer. The reason being that stem cell therapy promotes growth of cells, and we don't want to turn on tumors and we don't want to advance cancers. Now, there's not been any documented proof or cases where this has actually happened, but theoretically this is a possibility. So we avoid treating those patients with stem cell therapy. Another condition is what's called loose bodies in a joint. So that simply means if a small piece of bone or a bone fragment is inside a joint capsule, and this happens a lot with degenerative arthritis in the knee or degenerative arthritis in the hip and shoulder, if there's a bone fragment in there, that bone fragment needs to be removed surgically before stem cell therapy can be performed. So those patients are not immediate candidates for stem cell therapy. Another condition is going to be if the joint is so badly degenerative, so if with severe advanced arthritis, sometimes the better option is going to be surgery. And we'll explain that to the patient and we'll recommend what we think the best option is, even if it's not a service that we perform here in our clinic. One other thing that we see often, particularly with knees, is if there's a meniscus tear and part of that meniscus has been dislodged or is sort of flapped over. In that case, that piece of meniscus needs to be surgically removed before we can perform a stem cell therapy on that joint. And lastly, a big one is bone spurs. If there's a bone spur that's, say, cutting into or irritating a rotator cuff muscle, or a bone spur in the ankle that's causing damage to a ligament or tendon, that bone spur needs to be removed first before we perform a stem cell therapy to repair the damaged tissue. So the best way to think about it is, if something needs to be removed first, stem cell therapy is not going to perform that function. Stem cell therapy only regenerates tissue, bone, ligament, tendon, cartilage, but it doesn't take things away. So if something needs to be taken out, or a bone spur needs to be removed, or a bone is deformed to the point where it needs to be surgically altered before we perform a stem cell therapy, those are conditions that would make it so that the patient's not a candidate for stem cell therapy, at least initially. So if you're interested in finding out what the best treatment is for your injury or your degenerative arthritis, please reach out to us, because we'll be able to tell you whether what we do is going to be best for you, like a stem cell therapy, or we're going to tell you that surgery is a better option. And we certainly want to see all of our patients get the best care they possibly can. So we're going to tell you what our honest opinion is, whether we perform that service or not. So if you have an injury, if you're suffering from damaged cartilage, degenerative arthritis, a ligament or tendon tear, please click on the link on the bottom of the description of this video, which will take you to our homepage where you can request a free consultation with our patient coordinators that will answer any specific questions you have. We look forward to hearing from you.